Yeah. Yeah.
Thank you. There you go. Did you email it or?
That's cool that I saw. Yeah, it's okay, right, it's not. I like the whole set of them. Yeah, that is nice.
Well, they kind of messed up. It was the border from Canada.
Okay.
Yeah, but cut it so it's yeah. I mean, we didn't. I'm calling them about to see if they can give us like, I don't know, some kind of next order. Yeah, that's like.
Hello. How are you guys? This isn't Rachel, I don't think she.
There's a chicken egg.
Yeah, I'm tired. But I did grow up, this is funny, you moved there when I was 10, but I. A lot. It was more fun than we expected. I know. You guys have been going? Yeah, this is great. Alright. Enjoy your lunch. Thank you. Yeah, yeah. I went to Santa Fe to see my friend this weekend. It rained like crazy there, because you know, with the weather, but it was fun. We went to film fest, so we saw Bryan Cranston speak. What a nice person he is. Yeah, he was in the Breaking Bad, but he's been in a lot of other stuff, but that was kind of where he became the most famous. Yeah. But like, he's been married for 35 years and you should tell, he's just a really nice person. Yeah, because you know, some of us are nice people, right? Good morning.
So is the Zoom? My computer's turned on right now. So you want me to turn on? Please do. Okay.
Next quarterly, still in person and virtual for the fall. In January.
That's a good question. I like doing, I mean, hybrid's hard, but it's nice to be able for people, as long as what, we never know what weather's gonna be. Yeah. Which is curious.
Like the inclusion.
Yeah. You have the,
Good to see you in person.
Been a while.
January 13th.
But yeah, actually, I'm trying to figure out, has it
so
happened?
to say we're planning on
Like,
hybrid, so it may
right,
change
coming
if
out of-
weather is.
You know, on top, but it's troublesome.
We're real humans after all.
No, it's me.
Yeah.
So, mommy, hey, how are you doing? Good.
Hey there.
Fine.
How are you doing? A big sigh, huh?
I mean, it's Monday morning.
It is Monday morning.
Bits.
Good morning. How are
I had to
you?
finally turn my heat on, you know? I was sure to
Did
pull
you
out.
get my email? Some of them are doing spam because of the.
Yeah.
It's just a problem.
Good to see you both.
Sherry got Corey at.
Good speaking today.
So sometimes people are getting.
Oh, I'm good. You guys are good? Winter finally decided to start showing up. So
Yeah.
we're beginning. It's just being smart. Oh, yeah, well, yeah. I go back and they're like, what happened? What? Where'd you go? Anyway, fun?
Which is fine.
Yeah.
Taking a step forward.
Yeah, exactly. That always happens to me if I take a picture. I just expect. No, it's-
You're not even gonna compliment.
Oh, no. Next. Yeah, but. I know. Sitting upstairs, so yeah, we'll bring you up there. That's why the good stuff. Thank you for doing.
Yeah.
Okay.
What's new, man?
Is that the best place to speak or what?
Good to see you too. How are things rolling over?
Yeah.
Just talking about. County commissioners, representing, this one, and up to them, and we can start continuing funding support.
Yeah,
and all that
people
stuff.
joining you. Cool.
Everybody wants money.
Already,
Keith, I'm
nice.
so shocked that you would think that that's what I was talking about. Why would you say that?
Huh?
First thing on the
How are
agenda.
you, Alex? Good to see you.
No, it's going really good. Really good rollout.
Phone's literally ringing quite frequently from.
I know, right?
It's amazing.
So we got people about 20 on there. And on for minutes, just let you let people know when we started.
It takes a while. Sometimes I have for
Yeah.
everything to fire.
So I have to like cut and.
Given the fact that it's.
Supposed to be a
I mean, I think I said it on the school.
Yeah. Yeah, they just didn't do the picture.
Yeah.
So that's what I would direct. Yeah. It's just gonna be a.
I know.
Right.
Just a reminder, everybody, please grab lunch in the back, and if you're like me and you needed more coffee, there is some coffee in the kitchen.
Yeah. All right. Well, welcome everyone that's in the room and welcome for those of you that are online as well. So this is our West Mountain quarterly meeting. We're so good to see most of you in person. It seems Old Man Winter has visited us finally. And as most of you know, I'm not very excited about it. So I want to put that out there. Not very excited. Let's do this. I know there's a couple new faces for me anyway in the room. So if we could start by, let's just do quick introductions, your name, your organization, and we'll do something fun. Maybe tell me what has been your best Halloween costume over the years. And so share that with the group. For those of you that are online, if you'll put that information in the chat, maybe we can see that as those chats are coming in. But I'm gonna actually start over on this side with Christina. We'll do this side of the room and then we'll come back up on this side.
Awesome, thanks, Sherry. Christina Guerra, West Mountain Regional Health Alliance. Welcome everybody in the room and online. I think one of my favorites was Wonder Woman, just because it's Wonder Woman. You can't go wrong. So.
I'm Stacy Gavrell. I'm with Valley View Hospital. I also serve on the West Mountain Regional Health Alliance Board. I'll go with most recent, which I was a crayons.
I'm Sarah Sim, and I'm with Mountain Valley Developmental Services. I have not dressed up for Halloween in a bajillion years, but I think we furnished the good, the bad, and the ugly.
Well, good morning, I guess it still is. I'm Heath Harmon from Eagle County Public Health and Environments. I'm gonna go with this year's costume. I'm gonna be Lars from Fire Saga. So if any of you have not seen Eurovision songwriting contest on Netflix, starring Will Ferrell, I'm Will Ferrell's character.
Morning, Hans Luckring with Mind Springs Health, and probably one of my best was dressing up like Lance Armstrong with the syringe out of my arm.
Very nice.
It might have been a little too soon. I think it was.
Sarah Brainerd, Garfield County Public Health. I think one of ours was a wine and cheese, couples thing, and so I got to be the bottle of wine.
Mason Hosek, Garfield County Public Health, and I was Sophia Petrillo when we did the Golden Girls.
Sophia, she's awesome.
Hi, my name is Wendy Gill with Mountain Family Health Centers, and I will say, pirate.
Hi guys, I'm Becky from A Way Out. And my best costume, I was a human disco ball. I had CDs all over me and to shine the light on me at work.
I'm Jenna Ward.
I'm the Colorado Department of Public Health and Environment. I'm serving as the West Regional Coordinator and was part of the Northwest, but transitioned to a new role. So thank you for letting me be here today. And I think my best one was we made homemade Care Bear costumes. So me and my family did that. It was pretty fun.
Hi, I'm Namrata Shrestha. I am a Health Access Director with West Mountain Regional Health Alliance. I've never dressed up before, but this time I'm gonna be with my sister. I'm gonna be in Florida. We're gonna be rock, paper, scissors. My brother-in-law.
Hi, Bertie Rivera, Health Alliance, and best one would probably be the last year's. I was a voodoo doll. It was a pretty scary one.
Hi everyone, I'm Monica Bruto. I'm the Homeless Services Manager for Eagle County. I'm also co-chair of the Valley Alliance to End Homelessness. And I would say my best costume was Cindy Lou Who from The Grinch.
I'm Keith Berglund with West Mountain Regional Health Alliance. I'm the Housing Access Manager. And first, like 25 years ago, moving to Aspen, and it was kind of Halloween's a big thing for adults. And Star Wars, and of course I was Chewbacca. And I covered in like fake. It was horrible. Good but from the outside, but from my experience, it's hot and sweaty all night.
Hi, everybody. My name is Denise Dion, and I'm the Patient Care Friend Coordinator for WMRHA Health. And I think my best costume was one year my husband went as Cheech, and I went as a hippie chick.
I'm Rachel, case manager for Grand River Health. I made myself a Kleenex box costume I'm so proud of, but then come find out you can't sit down in that.
I'm Ariel Holstein, Pickens County Public Health, and this is not very original, but I like to dress up as Little Mermaid because we share a name. I can see this kid, but I tell them I'm Ariel, and I think I'm the mermaid.
So Sharon Longhurst Pritt with Garfield County DHS. It sounds like we're sharing Halloween costumes. Been a number of years since I've dressed up. Probably my most creative one, and I'm not horribly creative, but I was about 6 or 7 months pregnant and I went as Miss Piggy, so.
I'm Alex, I'm consultant for WMRHA Regional Health Alliance. I dressed up on things. Maybe the best one was Dwight from The Office.
Nice.
Well, and I'm Sherry Corey. I am with Quality Health Network. We are now an affiliate of Contexture. I am Director of Development Engagement and also the board chair for West Mountain Regional Health Alliance. It has been many years since I have dressed up. I would say my husband and I dressed up as minions one year. We do harvest festivals. We don't necessarily celebrate Halloween. And so we did that with the kids and it was fun.
Mike Barbie, I work with Regional Health Alliance, mostly as team manager, but also help on IT. Different operation.
Costume.
Oh, costume. I went as Mel Gibson's character from Braveheart back when I had dreads.
Do we have any interesting ones in the chat you can share with us, like some costumes from people that are sharing their costumes in chat? Pick us some good ones. Let's see who they are.
Looks like everyone just checked in with their affiliation instead of in costumes.
All right. Well, if those of you on the line would like to put in your favorite costume, we'll come back to that. We'd love to hear from you. All right, I'm gonna hand it over to Christina.
Okay, thank you. Well, maybe next year, the quarterly meeting in October, we'll have to wear costumes. Oh. Nobody will show up, that's good. Oh, okay, perfect. Exciting. All right, so I am gonna briefly talk about our mission. So we're really building on the healthcare system to achieve optimal health for all people in the West Mountain region. All of you know this, and I think even more importantly is sort of our purpose is about creating whole health systems around social determinants of health. All of us in this room know that health is not just your physical or mental. Well, mental health is a social determinant, but also, do you have adequate housing? Do you have food? Do you have employment? Do you have transportation? And so that's why we There we go. So this is our awesome board of directors, and I want to point out that we have one board member who's not here today. I think he's out of town. Chris McDowell, who has been on the board pretty much since the very beginning. So he's been on the board for 9 years, and followed by Sherry and Annette, who've both been on the board for 7. So I want to thank all of them for their longevity and being part of the West Mountain Board. That's really important to have that institutional board knowledge and really be part of it. And then we have as well. So will everybody raise your hand if you're on the board? So we've got, I've got a lot of good board members in the room. We've got Sharon, Hans, and Stacy. And we also have 4 new board members, which we're very excited about. Hans is one of our new members. Becca from Grand River, Violet is from Rocky Mountain Health Plans, and Alyssa is from Aspen Valley Hospital. So we're very thankful. We're still looking for potentially 3 more board members. So just putting that out there as well. Here's our current staff. I think everybody is in the room today. We are hiring for 2 positions. We're hiring for Housing Access Data Coordinator, which we're in interview process, as well as the Administrative Coordinator. That position was on hold, but now we're able to bring it back, which is very exciting, especially for me. Quick overview of our strategic plan. I'm not going to go into everything, but kind of the big pieces are system strengthening. I think that is really the main reason we exist, is to build better systems, whether it's around housing and homeless response, food security, health access, but really just making that happen. And all of you in this room are part of that because you're the ones doing the awesome work to support the people who need support, whether it's healthcare or housing or food or all of the myriad of things that everyone in this room We definitely are data driven. We've seen results from that through the Valley Alliance to End Homelessness. Talk a little bit more, but we did achieve quality data through Built for Zero, which is a big deal. Took longer than we thought, but it also puts us in, I think it's number 6 in the nation around quality data, which is really cool. Influence, just helping to make sure that we're influencing conversations around what's happening and helping to support all of you in your work, and being part of the state level and the national level conversations as well as our local. Collaborative funding, we're going to talk more about that. We have been very successful when it comes to homeless response and housing funding. We're working in other areas. We have also had some success around food security. And essentially what we do with the collaborative funding is that we bring together the partners and we write a collaborative grant, which is much more complicated than just one grant, because you're making sure you create a grant. And those of you, I'm looking at Stacy, who've done grant writing, know you have to understand what each partner is doing within that. And then finally, just working on sustainability. And I think that's something that we're all trying to do, to be able to do the work, but have sustainable funding to do so. So I just wanted to share a few accomplishments in a couple areas. So the board is in process of doing sort of a strategic plan refresh and getting really clear about the pieces that we are continuing to move forward on, at least in the next year. You can't do every piece, but getting really clear about where we want to focus. And I think there's definitely going to be a focus on fundraising, marketing, and continuing to grow the board and staff to have a really strong network. We did get awarded a in-kind grant from Civic and Center. I'm gonna know what that stands for. No, but it's about healthcare data, and so they're working with the Colorado Health Foundation, and they gave us a technical assistance grant to support a data dashboard project. And so looking at our public health people and looking at our healthcare, everyone in the room, because we really are going to be engaging to talk about what do we want this to look like. For a long time, we've been in this process. We don't want to reinvent anything, but we have the opportunity to work with this group and really bring it forth. And it may not look exactly like a data dashboard. It'll be, and that project should be completed by June 2025, fingers crossed. Okay. So we also completed our operational transition from Mountain Family at the end of last year. There's always a few lingering things that have happened this year too, but we really engaged consulting around finance, HR, and IT. We did hire 5 new staff members. Obviously, we're hiring some more now, but continuing to work towards having a full staff to make everything we do happen. Patient, it's not easy. Not in our world where everything's a lot of times instantaneous. So the Valley Alliance strategic plan is in implementation. We're gonna have some conversations about getting really clear about which pieces we're focused the most on going forward. In November of last year, we started the administration and implementation of the Transformational Homeless Response Grant. That has been awesome because through May, we spent almost 500,000 was passed through to our partner organizations to do that homeless response work. The challenge is how much administration is required. We just had a site visit, and one of the reasons that we were one of the early site visits is because we have one of the most complex grants with us and having 5 partners receiving funding. And so that's been a journey, right, Keith? We're learning a lot. We're also VAH has been supporting our newcomers and our migrants, and we were able to write a Colorado Trust Housing Sustaining Grant for $355,000 that will support our newcomers and immigrants with provision by Recovery Resources, Alpine Legal, and Mind Springs Health. We talked about the quality by name list. Congrats to all that made that happen. It's a pretty amazing thing. And that required everyone and our former housing data coordinator, Mike played a large role, Keith played a role, and then all of our partners who are entering data. It is a big deal because we understand more clearly who's experiencing homelessness. And I think there's still a realization that at times we're still not always identifying everyone who's experiencing homelessness. For example, I just recently had a couple conversations with Wilton, whose son Colin, and I get a little choked up because it's sad, but they're gonna provide $1,500 that they raised for services for those experiencing homelessness. He came on hard times. He's dealing with the substance use problem. I can share this because I've been given permission. And he thought it was alcohol, but he didn't reach out to his family. And so it turned out he also had meningitis. And so he was in the hospital 5 months on and off, and then he passed. And he was a longtime Carbondale resident, and his father shared that that they didn't even know that he was one of those people that just won't ask for help. And it just reminds you of how important this work is. And although we can't save everyone or meet every need, it becomes clear. They found us through just seeing some of the work that was happening in the valley. And just a reminder of why this work is so important. So we're gonna put the fund in Colin's name, and then that will be used for sort of smaller necessities that people experiencing homelessness. So it's really cool. So McFinn's Mountain Coalition for Food Nutrition Security is really just operationalizing the strategic plan, prioritizing goals. What their primary goal right now is a gaps analysis of food response programs that will be available at, that should say 24, sorry, that's my mistake. And then really cool thing, the food tote program moved from 8 participating clinics to 14, which also includes 3 libraries. So there are several spots where people can get a 72-hour food bag to support them, but they also get connected to the larger resources, such as where's the food pantry near you? Are there others? Getting connected to the benefits like SNAP benefits that are available in WIC. And so that's been a really cool thing. And I want to thank WMRHA, her work with that. And also we transitioned that so Lift Up does the actual distribution with the cost. So I have to thank Berta. So the resource directory on our website is live, and you'll see some flyers over by the front of the board. We also, the print guide will be available in January, yay! And so this guide is designed to provide some of you in the room, care coordinators, other folks who are trying to find where to send people. So it'll be a print version, and then the other version will go out to the public who they're looking for. So it's very exciting, and I want to thank Berta for continuing that work because it's a lot and it's important. Other good thing is that the resources are being updated in CRN, which is awesome. We have, along with QHN West Mountain Scholarship 10, I might be wrong on the number, to use the community resource network for referrals and care team coordination. So I think that we've seen a lot of increased numbers, and I don't know, Sherry, if you can, there's anything else to share on that.
I don't have any recent.
Okay, that's a good. Yeah, lots of good things are happening. So I'm not going to go into this. I wanted to share a couple things, but I think a lot of you have seen this information in the past. This is on our website. It's not right. This is our strategic plan for Valley Alliance to end homelessness. We're also looking at refreshing it a bit and getting more clear about the pieces that we're gonna focus on in the rest of this year and the coming new year. This is some of the funding that we've been able to bring in for serving our homeless response and for serving. And I think this number is the most telling. Starting in 2021, 20 people were housed. And in the past 2 years, I'm not showing 2024, almost 400 people were housed. So obviously that's really improving things significantly. And the time frame to get people housed went down, although my understanding is this year that's been a struggle again. I think that still comes back to our affordable housing crisis. And so, but the cool thing is people are being housed. We have funding to help make that happen. It doesn't mean there's still not extreme challenges, and there's also going to be some challenges this year with emergency shelter, and so that's going to be tough. So, let's do it more at once. This is a little bit about McFinn's. You can also see this information on the website. Looks like someone's trying to join us. Thank you, Mike. A little bit about McFinn's strategic plan, which they're in the process of kind of focusing on different areas. And then here's our online resource directory, and then the guide in paper form will be up in January. Okay. Well, what questions do you have or things that I didn't cover that you'd like to know more about?
More just of a reminder, but for that print version, please send your information or any updates that you want by next Monday, the 28th. That's the deadline. If I haven't gotten to your email yet, I'm just working through all of them, but I have gotten a lot of responses. Yeah. And then Mike, I don't know if it's possible to put my email in the chat so people know where to send information to, and then I'll just leave like some cards up here for people if they want to take.
Awesome. How about in the online, if anybody asks questions or comments?
Keith is helping Mark.
Nothing yet.
Great. All right, well, that puts us in the next phase of bringing up our awesome panelists. And I'm gonna ask WMRHA to come in because she's gonna lead the panel and she'll do introductions.
Before we go to panel, we're gonna do a presentation. We have 5 awesome public health and hospitals. We're gonna come and present a little bit on their new assessment or public health improvement plan. On my list, I have first is Keith. And if you have any questions, we were gonna put that in later and include everybody for the questions, but so please make a note to ask that question, and now we'll include that at the end.
No one wasn't able to.
If it's helpful, you could always just allow me to share screen. I can do it that way.
Let's do it that way.
Let's go for it.
Because you're logged in on Zoom.
Looking pretty good for you. For everybody else as well. Well, hello, I'm gonna dive in and go through some things pretty quickly. I've got more slides in here than what we'll cover today. Happy to make sure that the slides are provided, so if there's things that we don't cover today that you're interested in, you can always reach out to me. Before I get started, I just wanted to acknowledge the work from some of our team members. I think Jeff Korn is on the line right now with us. So Jeff, if there's anything I get wrong, I'll ask you to kindly correct me. I appreciate you joining us, but I'm gonna go ahead and dive on in. I hope you don't get motion sickness. This is sort of the Universal Studios approach to presenting. We're gonna zoom in and out, and since I'm skipping through a lot of slides, it's gonna be a lot of zooming, so I apologize in advance. But some of the things that I'll cover here today are just the priorities and how we identified them. We'll take a deeper dive into each priority and actions today. Realistically, by actions today, they'll probably just land on a slide and let you kind of read through some of that. First thing is when we took a look at our process for the community health assessment, we wanted to make sure we were engaging with the community, in particular parts of our community that aren't generally part of the civic engagement process. In addition to that, they often are overrepresented in health disparities. And so in particular for this particular health assessment, we reached out to our Hispanic and Latinx community members, our youth, our LGBTQ plus community members, older adults, and then those individuals or families living with disabilities. You can see on the right-hand side of this slide that we engaged a total of 480 people. So we hope that we'll continue to make that greater as we go through the process. One of the other things that we have committed to, and you'll hear this from each of the public health entities, there's a requirement to do the assessment and a public health improvement plan every 5 years. For us, I think what we really learned in this engagement process is if we wait every 5 years to do that assessment and engagement, then we're probably missing something. So we want to try to figure out a way to do this on a regular basis and really develop relationships with our community members. And so when we did that engagement, we pulled in a whole lot of information. And then the most difficult part of this process, quite honestly, was then coding all of that information into useful tidbits and how we could then start to prioritize different issues. We, again, engaged with the community members to help us kind of sort through and prioritize some of the issues. And these are the ones that rose to the top. So decrease the burden associated with increased cost of living. We already talked about housing. That comes up pretty extensively. In fact, actually, of all the different community conversations that we held, housing came up in every single population group that we engaged with. In addition, transportation came up in those areas. And then another one that came up was just not knowing what resources are available in our communities. And I feel like that's not unique to Eagle County. I think it's probably something that every county and jurisdiction deals with. But in the first year here, we really have been working on scoping out what the cost of living priority could look like in terms of action plans. And so I'll cover that in a little bit more. Promoting social connectedness. This is really important. It ties to the third one here as well in terms of improving access to quality physical and mental health services. Essentially, we want to make sure that people have access to those clinical services when they need to, and also with social connectedness, we want to make sure that people are really connected not only within their families, but their schools, their the organizations that they work for, the broader community groups that they might participate with, et cetera. And then hopefully what that will do is help combat some of the isolation concerns and loneliness concerns that we've heard nationally. And so if you take a look at a sort of just a linear path in terms of our planning to date, this is what it looks like. You can see we started those engagement sessions in 2023. And then if you kind of scroll all the way over, the box in yellow currently is where we're at now. You can see everything on the upper track here is basically, that is our decrease the burdens associated with cost of living, which I'll continue to refer to as cost of living for the rest of the presentation. But then you have our social connectedness here in the center, and then you'll have our access to physical and mental health services down below. And so when we dive into this one, I think what I want to highlight here is as we go through all of the scoping and we've talked with community members, these are the 5 things that come up most frequently when we're talking about what are the things that get in the way when we talk about costs. Housing, as I've already mentioned, childcare, I haven't mentioned that, but that's equally important in all of our jurisdictions. Transportation, I mentioned briefly, food access and financial health. We are going to land on scoping out housing a little bit more so in financial health as we go into the next year. And so financial health, quite honestly, that could be, or quite simply, that could be, you know, opportunities to develop and create savings. That could be opportunities to better paying jobs. That could also be access to credit. These are the 3 things that we hear very frequently when we talk about what financial health looks like. On the housing side of this, our role is not to build housing as a public health entity, right? We've got a lot of organizations that are doing that. So our role is just gonna be to lend a voice to that and make sure that other people that are making decisions understand actually the profound impact that the lack of housing or the scarcity of affordable housing or unsafe housing or the threat of being unhoused, all of that plays on health, both physical and mental health. And so as we look at this, one of the primary things that we'll hope to do next year is from all of these community conversations and the stories that we have about like families of four bringing a newborn home, they're renting a room in an apartment, they don't have access to the kitchen. They do have access to a bathroom, but they're paying over $2,000. They don't even know their roommates. So who knows if this is a safe place for that newborn? But these are the stories that we want to make sure that get elevated. So when we talk about affordable housing, we can also add that social determinant lens. I don't know that that we hit the right spot in terms of what that could look like regionally. I know there are many different jurisdictions that are working on this, but so much is done through a lottery system, and I don't want to say that that's not the right way to go about it, but I'm trying to figure out how families like I just described might get a little bit higher up on a list or a little bit more opportunity in a lottery system. Yeah. And so this is the part, if you do get motion sickness, just cover your eyes for a minute. I'm gonna go through this kind of quickly. And then in terms of social connectedness, one of the key focuses as we go into this year and next is really trying to generate a lot more opportunity and capacity for community engagement. We tend to believe that we actually have a better ability to hit the mark when we're actually engaging with the community in terms of what their needs are. So when we went through that community health assessment, we didn't go into it with data for them to look at and reflect on. We asked them quite simply from your experiences, what does a healthy and vibrant community? From that and from those conversations, we still landed back in this place with those three priorities. So for this year, we hope to do at least 5 community engagement sessions. Well, one thing that I'll highlight here, as we continue to have access from investments from our board, it allows us to turn some of those investments out into the community. And we've been working towards building that community capacity within organizations to engage with their constituents a little bit more so. And so we've also then been working on our own community engagement model. This is going to dictate and provide a whole lot more guidance in terms of how public health and environment engages with the community. Not every time that we're engaging with the community will it be sort of at a partnership level, but that's what we'll strive for. Sometimes it just might be information sharing or gathering, and so it might be a little bit more simple in terms of that approach. But once this community engagement model is developed, we hope to be able to share that with the rest of the county as we continue to make some strides towards inclusion and equity there. And then one other thing that I'll highlight here is we have a unique program called Campeones del Sistema. So this is all about building capacity within our Latinx community. This is now, gosh, I think 4 years. We've got the Colorado Health Foundation funding us for 3 more years, which we just got that award notification just maybe at the beginning of October. But one thing that this does is it's really helping to build that capacity so that community members are not only able to engage with their neighbors and bring those experiences forward and help advocate for what their community needs are, help represent what their community needs are, but again, improving that ability to engage with within that civic process. All that said, I think what I've learned over the past couple of years is that we need to figure out then how to get the civic process ready to engage with all community members. So how is it that we actually open up those processes to meet community members where they're at? If you really want that engagement, that's probably one of the next steps that we'll work towards. And then getting down here to physical and mental health services, we're going to continue to work on assessing gaps. Home health is a significant gap that we've identified. I don't think that's unique to us, but nevertheless, that's one thing that we're hoping that we can make some strides on improving, because we do have some entities that are working in that space. And if we can give them a little bit more funding and advocate on their behalf, maybe what we have is better access to that home health. We also are working on increasing immunizations. Quite honestly, this is doing it in a way where we're filling a gap because access to physical healthcare services, at least in the Eagle River Valley, seems to be significantly different than what we're seeing in the Roaring Fork. And without getting into a whole lot of detail on some of the data, that's just some of the things that we're seeing, and a lot of that is due to provider vacancy. And so in that absence of providers in this particular area of immunizations, it is a space that we fill, but we're actually stepping up and providing a lot more immunizations in current years compared to last. I'm gonna jump through some of this information a little bit more quickly. Sorry, these are pictures of our last vacation. Just kidding. That's actually a remodel that we did to try to make it more inviting and welcoming to clients and all community members. But I'm gonna jump through and I'm gonna end right here because I think we only had 10 minutes and my guess is that we're pretty close, if not already over. But you can see by the end of 2024, everything in that letter colored box on the far right, that's what we're hoping to accomplish this year. We're hoping to continue to kind of update this on a yearly basis, so you'll continue to see it get longer and longer. And I don't know how we'll make that fit into the slides in the future, but I'll be happy to take any questions once we get to the panel discussion later.
Sorry. Next on our list, we have,
Okay.
I'm gonna keep on sliding down. I want that space that's right there by the podium. It feels a little bit more legit.
Everyone, afternoon, it's afternoon finally. So, I'm gonna go kind of to.
Oh, see, it's not just you.
okay, good.
Yeah. You just have to hold down just a little bit and then.
So I'll, while I'm working on this, I'll give a little bit of background on how we conducted our community health assessment and then our public health. So in the summer, early fall of 2022, we surveyed residents of Garfield County. We had over 350 responses to our survey. That survey then influenced our 5 community. Oh shoot, I had the word. We focus groups, thank you. We had 5 focus groups in each of the municipalities where we brought the data that we had found for each of the communities and asked them if they felt like that was what they were seeing or what they were actually engaging with as community members. And then we asked for them to give us what they thought their priorities were. So, okay, perfect. So I did this on Canvas, so the format might be a little off. So from our surveys, what we found, the #1 economic factor that's impacting personal health are jobs that cover the cost of living, affordable housing, and then access to healthy foods. And then on the other side, what is the #1 societal factor that impacts your personal health? And it's the high cost of living. I don't think anybody here would say that that's not true. Okay. So when we think about the social determinants of health, what we also found is that in Garfield County, of the approximate 6,500 rental units in the county, about 2,000 were cost burdened, and that means that you're paying 30% or more of your net income to rent. And of those 2,000, 1,100 were paying more than. In terms of transportation, workers in the county had a commute that was longer than the national average, with nearly 7% of workforce traveling 90 minutes or more. And then we get into food options. There are approximately 8.4 fast food establishments per 10,000 people in Garfield County, and 1.3 healthy food establishments. I had on here before, somebody kind of questioned it, but the state of Alabama only has 6.1 fast food establishments per 10,000 people, and yes, they're not the same. Yes, they are different. But when we think about this, we get it. But when we think about all of these things in together, right? When we think about all of these things in together, why might we have more fast food establishments? It's because people are traveling more. There's the need for convenience and also costs, right? The costs associated with purchasing what would be more healthier food items from the grocery store. it is cheaper, we know that processed foods, fast foods are cheaper for people. And people, if you're spending an hour on the road, that's 2 hours per day, your focus is probably not what you've been able to do. Okay, so then the focus groups, you took all of those things, the themes from the focus groups, food quality and healthy food outlets, that makes sense from what we saw before. Mental health services and reducing stigma. So, really thinking about bilingual, bicultural providers in education, seeking mental health services, and then an increase in primary care physicians. How long have we been working? Yeah, and I think during our first public health improvement plan, access to providers was one of the things that was brought up. It was the thing that was brought up when we conducted our regional community health assessment in 2016. And now we're obviously seeing in the Eagle River that provider access, if you have, it's definitely something that everybody feels. I kind of already talked about this. Those priorities don't necessarily feel disconnected if we think of the larger picture. And so what can we work on? What can we actually work on? I love the idea of public health finding ways in terms of the cost of living and what you can actually move the needle on. But we decided to focus on our mental health access and reducing stigma and food quality and healthy food outlets. I hate to say that it's partly because those are things that we were already working on. Is things that we were already working on. So why not incorporate it in a more formal way into the work that we're working on as a department. And so in the summer of 2023, fall of 2023, so a year ago, we brought our health equity team, now our health access team, together to write the PHIP. And the reason that we did that is that we developed activities and priorities and goals and objectives that we as a department can work on. The health equity team, are made up of individuals from each of our sub-departments, so environmental health, our nursing staff, our front office staff, et cetera, to come together to write some of those activities. And I think I have some, yeah. So this is a little late. Well, we've been working on this. There have been changes to this, but our goal, people in Garfield County will have appropriate support when seeking access to resources while reducing stigma and increasing the normalization of mental health as part of one's overall health. And then we have some objectives and activities. So this is an old one. Nutrition. And yeah, so that's. When we were talking about having this presentation again, I wanted to make sure that a lot of people have probably heard these things. Some of you may be for the first time are hearing this, but it's maybe not the first time that we've sat in the room with you when we've discussed our bit. So I was wondering what would be the angle that we would want to bring to this. And for us, in terms of Garfield County Public Health, we would like to create a PHIP advisory board of our partners, probably from HSC. We didn't get a chance to ask them yet. We'll ask them in 2025. But just because, since we're partnering with all of you, we partner with Mind Springs, we partner with Family, we partner. Is the work that we are doing and the activities and everything, does that still kind of make sense for the people that you're actually serving? And I love the idea of more of not necessarily doing it every 5 years, but kind of seeing in 2 years or a year and a half and saying, okay, well, this is what we were working on. Is that still the focus, or has something, because, it does kind of doesn't necessarily seem proactive, this process. It seems pretty reactive, and it doesn't even seem to be really reactive in real time. Right? So we're working on something that has been identified as an issue or a problem the past 5-10 years. And so now we're working on it now. How can we do better to really work on those things that are coming up in our communities in a more actual time that they are happening? So with that, I'm done. Yeah.
The third presenter we have is
does this thing work? My name is Ariel Holstein. I am with Picken County Public Health. We're here to give you an update on our community health assessment and public health improvement plan. Great, this thing does work for me. Okay, so just a little bit of background. We completed our community health assessment back in 2022. The primary data that we collected for our draw was qualitative. We used two methods, key informant interviews and photo voice. That was actually a lot of fun. I was brand new in the role. We had to do this project by the end of the year. I actually hired 3 people in the community to do interviews and do photo voice, and I trained them. And they did a great job. It was a great experience overall. For the quantitative data, we used, I know Nathan and Heath are going to be familiar with the Colorado Health Indicators data set from the State Health Department, really geared toward health planners doing this work to provide a snapshot of data in the community, your county. And then we had some local data as well. There's like a Picken County community survey. There is Picken County did a mental health survey as well. So I used some of that local data in addition to state and national data sets. So between analyzing the data we collected, reviewing the data that existed, an internal capacity assessment of our department, as well as a community capacity assessment, we ended up with 2 priorities for our public health improvement plan, our PHIP, and those are access to care, including mental health, and climate change and health. We completed that plan in the middle of 2023. Okay, so there's way too much of the PHIP to go over everything, but for access to care, we have 3 main goals. Those are 1, education to the public and community partners about the importance of mental health. The second goal is around policy and just promoting any policies that we can to increase access to care, as well as expand the behavioral health and physical health workforce. We've already heard there's not enough providers, especially bilingual, bicultural providers. And then finally, designing and implementing what's called the Mental Health Access Program, or MHAP. And we'll talk a little bit about that more later. In climate change and health, we had 2 main goals, and those are again around education, just increasing awareness of the effects of climate change on health, and then incorporating a public health lens into our county's hazard mitigation plan. And so now I'm just going to pick out a couple of pieces we've been working on to provide a status update. Again, can't go over everything, but just some things that are happening that are interesting and challenging, as we all know this work can be. So for the Mental Health Access Program, this is co-led by Picken County Public Health and Human Services Department. It's a coordinated approach to serving individuals with mental health care needs along the entire continuum of care. And so the overall goal of the program is reducing barriers to accessing care, as well as gathering local data to better understand the state of mental health care. In the status of the program, we are in the early stages of strategic planning. This has been delayed due to staff turnover. So originally the strategic planning was going to be led by county staff, but because of turnover, that was unable to happen. So we ended up hiring a consultant. I'm not sure at this point if they have, so they've done the RFPs and reviewed the applications. I'm not sure if the position's not the right word, but if it's been offered to anyone, I'm aware exactly where they're at. But the plan is for this process to be completed by the end of February. So it is a little bit delayed from what is in the PHIP. If you go back and read that long report, but it is still happening. Another piece with access to care, including mental health, is I have been working in partnership with some other staff on my team and Valley Health Alliance on a primary care provider survey and interviews, tying back into Mental Health Access Program to collecting some of that local data. So the goal here is to understand patients' mental health needs, but from the providers and practice managers' perspective. Purpose, obtaining data that will hopefully help us direct funding once we know a little bit more where we're at. The survey was completed last year. We only had 24 responses. We had 15 providers and 9 practice managers. And currently I'm working on key informant interviews to better contextualize some of the findings we found. So here's my shameless plug. Actually, I don't think there are any providers in this room, maybe online. If you are a PCP or a mental health provider and you want to volunteer 15 to 20 minutes of your time to do an interview with me about your experiences with your own patient's mental health needs, please see me. I've done some. We need more data though to really make any conclusions. And I don't want this project to stall. So I'm still working on it slowly. I just need more people who are willing to talk to me. Quick update on climate change and health. So one strategy we're using here is working on building partnerships because climate change work, is really kind of outside the scope of a public health department. Picking County recently as in middle of last year, around the same time that we completed our PHIP, they hired a climate action analyst, and this person's role is to coordinate the county-wide work that will mitigate and adapt to climate change. So he is currently drafting the climate action plan. He's been meeting with all the different departments, talking about current climate work and climate work they want to do, kind of incorporating all of this into one big plan. So we have met with him, but we're awaiting for future direction. So again, this work is slow, it's happening in partnership. Taking a while as this work often does. Another big piece of our climate change portion is updating our county's hazard mitigation plan, with the goal really of increasing some climate change in vulnerable populations who will be affected by potential natural disasters. So Pitkin County's previous emergency manager retired in August of 2023. That was about 6 weeks after we completed our plan and had it approved. And this person was someone we're working with to update the plan. The new emergency manager did not begin until April of this year. So over a 6-month vacancy. And then once this person began, our team wanted to wait, give him time to onboard and get acquainted with all of the other work he'll be doing. We didn't approach him, I think, till May to even talk about this. So we've started discussing updates to the plan, but again, it's slow, it's moving forward, but much slower than originally anticipated when we wrote our PHIP. And so just wanted to highlight a few challenges of this type of work, which I don't think will be surprising to anyone in this room. Staff turnover, always happening. So yeah, just working around positions being vacant for a little bit and then having to hire new people and have them on board. It just takes time. This is both internal and external staff. Planning for 5 years. So this is my first time doing a PHIP. Did some work with the county when I was in grad school, so I had some exposure. It's really hard to make a plan for 5 years. Like it's hard for me to make a plan for what I'm gonna eat for the next week. So just putting that in perspective. And then stuff is always coming up too that fits into the PHIP that you didn't see coming when you wrote it because it's new and emerging. So I'm thinking of our PHIP as a living document and also adding things that apply as they emerge. And then working with partners is hard, both internal and external. Not in a bad way, but everyone is busy. Each organization, each department in your organization has their own work plan, timeline, priorities, etc. So it can just be hard to coordinate and always takes more time than you think. I'm always every day surprised at how long things take. I shouldn't be, but it's always surprising to me. And I have left my contact information. Yeah, feel free to reach out if you have additional questions.
Thank you. I kind of resonate with working with partners. Anyways, because we are one of the partners. So, the fourth person is the health. Amy, it is.
Someone.
Yeah.
Hi, can you guys hear me?
I cannot hear you.
That's what she said.
Can you hear me or no?
Asking if we can hear her reading lips.
Can you all hear me?
We can hear online.
But they can't hear in the room, maybe.
Like folks online can hear her.
Mike is trying to tweak some items. Amy, we're not hearing you, so just give us a moment. We're trying to figure stuff on the room. You do not have IT issues, and the meeting is not.
Just go to audio, I think you can. Choose the speaker. Maybe room.
There's the green border around her. Which one she is speaking?
Give us a sound check one more time.
Maybe what we can do is we can start with Stacy, and then I'll have some IT here to fix that. Is that okay, Mike?
Yeah, it's a good idea. Let me
Yeah.
check.
Amy, I think you can hear me. So
We can hear you fine. Can you hear me now?
We're gonna start with Stacy really quick, and we're gonna have IT person come here and figure out why we're not hearing you. Is that
Okay.
okay? Okay, thank you. Stacy.
So I think what I'll share today will be a transition from the work of public health to the work of our hospitals. So like Nathan, I think I'm gonna kind of quickly go through a deck to give you a little bit of background on where we are with our current community health needs assessment. So our current community health needs assessment actually kind of comes due at the end of this year. So we're in the middle of a new community health needs assessment. So this community health needs assessment has not been approved by our board of trustees. So want to give that caveat, but a lot of the same themes persist. And I think what's also great is a lot of overlap, a lot of connectivity to the focus and the work of our public health partners. So I think that's great, in as much as any of these needs that we're talking about certainly can't be addressed tonight.
The title of yours?
I'm sure it's CHNA. I could probably do fails because I'm that we're all comfortable.
Is that it?
No.
CH. Grand Valley?
No, Valley View.
Valley View, sorry. See it now.
So where do I need to?
I'm gonna have to advance it.
Oh,
before we-
you. Near you.
That's you, go ahead.
Oh, so exciting. Okay, this is not me on my most
I was
recent
gonna say, is
vacation.
that you?
Yeah, thanks, Karen, appreciate it. So this is the executive summary of our 2024 report, again, with the caveat being that this has yet to be improved. So like the other entities have shared, we'll kind of start with a little bit of a background. So from the hospital lens, our community health needs assessment process occurs every 3 years. And again, leading out a process that really with the goal of engaging and getting as much rich community feedback as possible. So Vertical Strategies has been our partner. They're an independent firm that we like to work with, just again, so we can have as much outside perspective as possible. Maybe.
It's a little touchy.
There we go. So for those of you who don't know, Valley View is the hospital here in Glenwood Springs. Since our founding in 1955, we've really evolved to become a regional healthcare provider with a whole array of services, from primary care to some of the area's only specialty services. For example, we're the region's only 24/7 cardiac cath lab, which is really important for anyone in our community experiencing an acute cardiac event. Also a network of primary care that we're really proud of, that stems from Silt over in Western Garfield County all the way down into Willits. This is our mission and vision and values. I won't take time to go through that. Services. These are our locations. So this is, I'm just going to go through this quickly. This is a recap of what is still our current community health needs assessment. So looking back at our progress. So in 2021, we decided to focus on coverage and total cost of care, as well as addressing community behavioral and mental health needs. So again, it's nice to see these themes are consistent across all of our work. And again, as we've been doing this work, we've definitely worked with many of you. So I'm incredibly grateful for the partnership. So this is kind of our key initiatives where we focused to improve coverage and total cost of care. Really going through and looking at primary care, not only within the Valley View network of care, but within our community as a critical point of investment. So again, within the Valley View network of care, we have pediatrics, women's care, internal medicine, family medicine. Also, we're really proud partners and invest in Mountain Family Health Centers, which is our federally qualified health center. They're right across the street from the hospital, and we provide their rent every year. So we feel like that's a really important investment that Valley View is making for community and patient benefit. Some of the other things is really looking at overall patient well-being. This has been some of the work that we've done with West Mountain and our WMRHA, really understanding that whole health lens for our patients so we can make appropriate referrals and connections. And then looking at coverage for vulnerable populations. So one thing at Valley View, certainly we recognize the cost of care can be true barrier. So looking at our own financial assistance program. So that's for people in the Valley View network of care for families of up to 500% of the federal poverty level, which is a really significant or high income threshold. And it's something that we're really committed to, particularly with increasing financial headwinds from some of our payers and the lack of reimbursement from our payers. So we do really, for those of you who work with and provide direct client care, we really want people to reach out to our financial assistance liaison so we can connect with our patients and make sure that they're getting full access to assistance, whether it's through the Valley View program or other programs. Also been involved with the Valley Health Alliance, West Mountain, really looking at the overall cost of care as a point of care decision. For example, I think we all know that the emergency room is probably the most expensive location to seek care. So we've been trying to promote our after hours urgent care. So this is an offering we opened in 2021. We were eager to set it up to allow patients to self-select where they need to find care in a timely way. We didn't want to erode the importance of people having a primary care doctor, but we also appreciate that, like on Sunday afternoons, that's when you get to a certain threshold with your sore throat and you cannot go on, but you also realize you probably don't need to go to the emergency department. So we've been proud to have the after hours urgent care and trying to continue to promote that so people know that that's a care option that's less expensive in our community. Also been working on length of stay and other hospital-based initiatives that in turn affect the overall cost of care. And I don't know, Mike, there we go. So those are kind of at super high, fast level where we are with access and cost of care. Now turn over to where we are and making investments and initiatives for community behavioral and mental health needs. So for Valley View, oh, there we go. So this has been a great collaboration with many of us here in the room. So we're excited to be with, today in Glenwood Springs. We actually have a really high quality detox program. So this has been, I look at Sharon, Hans, like this has been an awesome multi-year effort to bring to this community a service that has been lacking. So we're grateful for Mind Springs for operating and the investments from the Garfield County, City of Newcastle, Grand River. There have been so many community partners involved in seeing this open. It just opened this year, but continuing to make sure that for those members in our community who need a safe, medically reliable place to detox, they now have a place to do so. Access to quality psychiatric care. So this has been, so if you know Dr. Pete Wiley, hopefully you think very highly of him because he's an awesome asset to our community. So in addition to him, we have 2 psychiatric nurse practitioners. So those have definitely been an investment due to, again, the reimbursement challenges in the mental health space. So grateful to have him as part of Valley View along with his 2 team members. Something else that's a theme throughout here is certainly, and this has been a theme elsewhere, is, you know, how do we best serve our patients whose first language is not English? And in a healthcare setting, we want to make sure that's a really credible translation and interpretation experience. So we have, it's a pretty cool platform. It's electronic on-demand service. So depending on the patient's language, whether it's Spanish or Vietnamese, we can make sure that the provider can quickly call in and have that technology available. Also, more recently, we are investing in having our own staff be certified as healthcare interpreters. So I believe this is a project that a number of the area hospitals are working on, ALTO. So how we reduce prescription of opioids and still making sure that we're appropriately addressing the pain and the pain management of our patients. But this is a larger initiative that I believe all of our area hospitals are participating and collaborating on. So the enhanced integration of behavioral and physical health. So I think this has been a really powerful development at Valley View, with the concept being that if you come in for your annual wellness visit and through a screening or conversations with provider, you are expressing concerns about being depressed or anxiety, we can do a warm handoff in that practice to make sure that that person is immediately getting connected to a behavioral health resource and not experiencing delays in that handoff. We just had a story, one of our patients in internal medicine came in. This was a person who had just left prison, had significant mental and physical health challenges. And because of this integrated approach in their primary care experience, we were able to have one of our staff members sit and have him get connected not only to enroll in Medicaid, but access veterans benefits. Also transportation and food insecurity were a particular challenge for this individual. And that all happened within the scope of one visit. So that was really powerful to help this person feel like they didn't have more barriers of having to come back and make additional phone calls. So that's where we're seeing, I think, a real opportunity. We've been able to expand this offering through some of the grants that we've been able to secure from the state. Otherwise, these are not really reimbursable patient encounters. So moving on, just like as everyone said, we've really been focused on getting community feedback and community collaboration. This is one of our, I'm gonna start going through, if I can. Someone giving us feedback on our survey about Dr. Wiley. And then so going forward, our 2024 community health needs assessment, which will hopefully be approved shortly by our board. Our process also looked at a lot of the data in our community to understand, you know, what the public health data is saying. Here are some of the demographics information for the community that we serve at Valley View. So that's Eagle, Garfield, and Pitkin County. We talked about the overall impact of healthcare here in our community as well. This is just some of the dollar figures associated with some of the investments that we've made in creating community benefit and community services. Our process include a number of you here in this room, so thank you so much for being stakeholders in the sounding board, just also offering really critical perspective. This is not hopefully the crazy Walt Disney ride, but. So we also did a community health survey. We had a really strong response of about 975 people, but we quickly realized into diving into that data, we had a hyper engaged group of survey respondents from the Carbondale community. So we kind of had to look through the responses through that lens, but it was still insightful. Community needs. So in terms of just trying to create a connection with what others have shared. So in our process, the top 4 health concerns expressed were mental health, aging, cancer, and substance abuse. This is a little bit of a snapshot again on that survey. This is where our stakeholders really honed in and continue to flesh out some of the community needs. So this is ultimately where we are right now today. So this is what our proposed new community health needs assessment will be starting on January 1st. So again, looking still at total cost of care, access and availability, and then social determinants of health. And for our process, we talked about really as a healthcare provider, where can we really lean in? So for example, you know, we're not particularly in a place to solve or really lead out the challenge of food instability, but how can we consistently be part of the community conversations? How can we look through the lens of, you know, expanding the TOPE program or other connections for our patients to make sure that their social determinants of health can also be addressed as we look at the whole health of patients. So there's a little bit more detail on each of these that I won't go through because I think they'll probably resonate with each of you. But I think as Mason illustrated too in his presentation, you know, this idea of partnership is a really big theme for us, and just looking at the scope of the challenges that we want to address and knowing that we will be better off in terms of the direct care and service of our patients if we can work with other people, but also there's greater expertise in our community to address some of these needs as well. So that's us. So thank you guys.
So knowing that you need a little time, maybe I hope you can hear me. Can we take a 5 minutes break? That's okay with everybody. People on the Zoom, we're just gonna take 5 minutes break so that Mike can fix what issue we have right here. Thank you.
I was curious how it's like.
That's what I wanted to share.
Thank you.
You know what, I forgot to tell him about this. So
He's not here.
yeah, so he's not here. So, yeah. But we'll talk about it later. Yes, it's like, oh yeah, I forgot that Zach is going to be reading this.
In the morning, but now it's
Otherwise you'd never leave.
because you were there. Then I ran in.
Yeah, whatever data.
I had to repeat that back to you. Yeah, I gotcha.
And we'll have it in the same place. We have already started. Yeah.
Is there any way I could get a copy of your slides? Yes, I really like the data on it.
Yeah.
See.
Okay.
Yeah, yep, I can send them to you.
Appreciate it.
Your laptop up here, we need to troubleshoot as a user.
Oh, yeah.
I didn't hear him say your name. I was like, who are you talking?
This is part of the solution.
Thank you. I really appreciate it. I really like the data on there.
Yeah, and I'll,
You'll be just
our
adding
PHIP
user.
and our chalk are
And
online, they're kind of hard to find.
Okay.
So I'll
You're
go
on,
into where you can go to find
Perfect.
the actual documents.
Perfect. Thank you.
Uh-huh.
For the referral part.
You're the presenter.
And I was like, right.
Well, I think it'd probably be okay. I only like reluctance, and it's not like a huge reluctance. It's not data.
Testing.
And we have this difficult transition computer system that the state's got up and running early this year. And so I'm not really sure how much used right now. You know, I think when it's stabilized,
So
that.
that's where I think sound is supposed to come out of your laptop.
On CRM.
Because I think that's what the number.
So I think we have room to even add it to our current contract, you know,
Yeah.
with CRM.
Yeah.
Without increasing our cost, so
Yeah.
to say. But it's gonna take some internal, just,
Yeah.
I don't know, internal conversation, internal, you know,
This
just
is-
adjustment.
We're talking
to-
about,
Yeah.
Brent being part of CRM. And,
Yes.
yeah, yeah.
Issues. Yeah, and we have more like, you know, CNA than just like Brent's team. I mean, they, and this is the group that I had reached out to you about actually a while back before Brent and his people that came from Mountain Valley even joined us. You know, I thought it would be a group to be part of CRS. What I was just sharing, is that we are just still in the middle of transition with bringing on these additional staff. members. Finding these two programs together, through just all those initial stages of transition. On top of that, we decided it was like a new computer system, and there has been like so many changes in that computer system that I think we could go ahead and just get it. I don't know how it's gonna get utilized, you know, right at the beginning. I think once they kind of get stabilized in the way of transition, and hopefully the state is working on the constants and the glitches, that they might utilize, you know, this referral source more. But my guess is gonna be that it's not gonna get used much in early stages. But it doesn't mean that we couldn't go ahead and get it turned on like I was. So I don't think we're using all of our users right now. And part of the issue, and there's a conflict with, that meeting, there's a meeting that's happening. Sorry. Have another good person to send to that meeting. They're finding, they're trying to find somebody who has sense within the, want to kind of like, they're in, you know, I got it up, I got it going, and now it's like, here's a comfortable place. To fit. Because it straddles like both of our divisions, we have two major divisions. So I just need to talk to one of those division managers about.
So, yeah, maybe there's a needle I haven't read quite yet. So she said it involves me. But so Brent, Mountain Valley Developmental Services. Now they're under you, with you. Okay, so they're still, are they under your tax identification and all that? They're a program under you. Okay. So originally, I think you guys had like 20, like that. You have not got all your users. So basically what we would do.
Unless we have one.
Nope.
Few more minutes, guys. Can I remove your charger?
Yes.
Need me to open it?
Yep.
And I'm asked to be a host, right?
Yeah, just reclaim.
Yeah.
Yeah, and all we need to do is, I can tell Tina, we just need to know how many users you have left on contract and how many licenses that they can use.
Yeah, and I think we probably need to our users anyway, because I'm not sure that all of our users are truly licensing.
Sorry. I think recently, like after you, me and Tina had that call, she sent over, here's the users and, yeah, so take a look at that too.
Yeah, and probably where it got stopped is it's like, oh crap, I need to find something else. This is not my, you know.
Finally, we stuff.
And let me go back to that, and I have somebody in mind. And, he's not over the CMA program. He's not-
I love that too.
Okay.
So.
Alright.
Amy, can you hear us right now? Anybody in the Zoom room, can you hear us?
Anybody.
We can hear you. We've been able to hear you, but can you hear us?
Yes, very much so.
Very loud. Perfect, you are now.
Yeah.
So we're gonna, since Amy can hear us now, we're gonna start our meeting. Are you gonna do the presentation or should we keep it?
I can share my screen, Namrata, if that works.
Yes, that'll be perfect. Thank you, Amy.
Okay, great. Give me 1 second here.
Amy is from Vail Health and she's gonna talk about the need assessment of Vail Health. Thank you, Amy.
Okay, can you all see that?
Can you see the presentation? Not yet.
Oh, no, you know what's gonna happen? This happens sometimes with my Zoom. Would it be possible for you to share it, Namrata?
Can you stop share and share again? Mike, give you access again.
Yep. Sorry about that. I just
Stop sharing, share again, that would work, we believe.
Can you guys still hear me?
Yes.
Okay. Yeah, sometimes when I'll share it, my Zoom will kick me out. I don't know why that's happening. We're on Teams, so it's just like a weird Zoom thing that'll happen.
Let us know when you're sharing.
I don't think I can share. Are you able to share, Namrata? I'm sorry.
Okay. Okay, Mike has it on and he's about to share with the room and Zoom. Thank you, Mike. Can you see that, Amy?
Yeah, we can. Perfect. Thank you. So thanks for having me today. As Namrata mentioned, I'm from Vail Health. I'm the Director of Quality and Patient Experience there. And I'm going to share a little bit about Vail Health CHNA processes. And thank you. I will just say next slide when I'm ready. So next slide. So like Valley View, Vail Health is on an every 3-year commitment to a community health needs assessment. Our last one was completed in the fall of 2022. So we are 2 years into that, and then we will complete another one by the fall of 2025. It is on our website, and the link is here in the slides as well. Go ahead, next slide. So from our last, I'm going to just kind of briefly go over the 2022 CHNA implementation plan and just touch a little bit on where we are with each strategy. And then I'll talk a little bit about where we plan to go for our 2025 CHNA. So obviously we've heard it from everybody today, right? And we hear it at WMRHA all the time. None of us can do this work alone. It really is about partnering with our community. And these are several agencies, several of whom are there in the room and online, individuals from such. And so we just so appreciate the ongoing partnership. And that's been really key to our CHNA efforts and the ongoing interventions that were built into our implementation plan. So go ahead, next slide. So there were 8 main strategies that we focused on. And these are them here. I'll go through each one just a little bit like I mentioned. So go ahead, next slide. So engaging and enrolling and connecting people to whole person health. This is really where so much of our behavioral health efforts came into play. And I think we heard that from almost everybody today as well. We're all working in that space. So obviously the expansion of our behavioral health service line at our community health campus in Edwards has all been really part of this work. And again, the continued partnership around whole person health, whatever that might look like from both the physical health and the behavioral health side. Go ahead, next slide. And then bringing care to the people, I would say our main focus here has been working alongside our Eagle County paramedic services. As Heath mentioned, we have been without home health in our valley except for veterans. Since the changes made at Home Care and Hospice of the Valley to focus elsewhere, they continue to be a wonderful partner in the hospice space. But really, we are seeking to fill that gap in home health services. We are seeing impact to our population because of it. It did show up in our 2022 health needs assessment because we were already seeing some impact there then. And so we are continued, the next slide. We're on bringing care to the people. Perfect. Continuing to work with ECPS on standing up a home health organization. They just received their licensure and they're hoping to start seeing patients. So this is incredible efforts as a community in general, and really awesome for ECPS to step up in that space and be able to possibly provide this service. So more to come, but that's been a huge focus of ours these last couple of years as seen in our CHNA. Next slide, please. Focus on prevention and early intervention. This is really where so much of our outreach efforts have been focused, along with our trauma services, injury prevention work around Stop the Bleed, and a lot of work around water safety by supplying life jackets along the in certain areas where we see some injuries and risk there. And then again, really focusing on our prevention is what we heard from our CHNA and what our community needs as far as education and what have you. Next slide, please. This is really increasing utilization of healthy foods has really been about our ongoing support of our the community market that is in Eagle County and does an incredible job in serving our community that has food insecurities. So we continue to partner and support them in that space. Next slide, please. Obviously, we can't continue to do the work that we do without addressing our healthcare staffing shortages, as we've heard from a few other partners today as well. And really putting a focus on diversity and DEIB in that space. So lots of efforts there from our HR team, and I'm going to talk a little bit more about how health equity plays into that as well. So next slide, please. Early childhood and family supports. I mean, this has really been incredible work by the county in relation to the Family Connects program. We've continued to partner with them, in particular our Family Birth Center and Eagle County Family Connects, to be able to see more new parents in the home. That has huge value. It's obviously evidence-based. So we really appreciate the partnership from the county on that. And continue to work closely on ensuring we're supporting this vulnerable population. Next slide, please. We definitely struggle. I know others do too, just in terms of leveraging our technology. We can only do so much with people in process. If we don't start leveraging our technology, we're going to not be able to get as far as we need to get. So we have a pretty disparate, as far as a health system goes, especially now that, again, we have behavioral health, we have ambulatory surgery, we have our family practice and specialty care. You know, we're a little bit disparate in our EMR systems. So really focusing on how can we do better with technology and interoperability, especially with our very wonderful partner QHN. And then looking ahead to where we can maybe start to move in more of a integrated interoperability system internally as well. So lots of work happening in that space. Again, that technology piece to support the people in process in order to better meet the needs of our community. And then we've really been also focused on advancing policy to improve community health. So really trying to get our voice heard in leveraging our partners at CHA and the AHA to really make sure, especially the community hospitals. I think that the larger systems obviously have a pretty large voice at the legislation table, but I don't necessarily think we don't necessarily think they're the right voice for the community hospitals, such as ourselves out here on the Western Slope. So really trying to get that voice of rural hospital heard, and CHA has been a great partner in that. So we felt it was a miss to not include some advocacy in our CHNA, because so much of what we heard in our CHNA is still somewhat out of our control in the current healthcare landscape. And so how can we really be that voice at the policy level? And next slide, please. So those 8 strategies were really what showed up in our CHNA in 2022, and that's what we've been focused on. Obviously, you all can review the slides, see kind of where we've been and where we're headed over the course of the next year to sort of finish out that implementation plan. Obviously, I think a few of you talked about, especially those our public health partners who have a 5-year plan. I agree. I have a hard time planning for the week, let alone 3 or 5 years. So obviously we've had to pivot along the way and make some changes, and that's inclusive in sort of the look back and then the current state and then the next year's worth in our in each of the slides. But one thing that really showed up midstream while we were still focused on DEIB and definitely had health equity obviously on our radar, and we're starting to stratify a lot of our data and things like that, is it just really did show up that we need to put more time and more focus on that. So we really started that work in 2023. We have a really robust DEIB committee. We used the American Hospital Association's they call it, it's on here, I know, Health Equity Transformation Assessment, their HEDA, to really do a nice gap analysis and then be able to compare ourselves to others that use that same AHA assessment. And then they have a really nice roadmap, and this is all free. So I have no, I'm full disclosure, obviously I don't have any skin in the game with AHA other than obviously them just being a good governing body for us all. So I would just highly recommend it to anybody doing this work. I think that it's been a really great tool for us to really assess where our major gaps are and where we want to focus our attention. So we have a great group focused on that. Obviously, our board and our executive leadership team is highly engaged in that work. And we will continue that work. I'm sure it will show up in our 2025 CHNA, and we'll continue those efforts. So next slide, please. So we did hold our annual community feedback session on August 5th of this year, and that ended up being really wonderful. I feel like we had a hard time getting our footing back with community feedback post-COVID. So prior to this year, I felt like we just weren't quite hitting the mark and where we wanted to be in soliciting that feedback. I know several of our partners were there, along with, just patients and regular old community members who seek our services and live in our community, which was amazing. We had 2 sessions. We had a morning session. There were 40 to 50 community members that attended that morning feedback session. We used sort of a small group discussion. We wanted it to not feel like a presentation, but really feel like a listening session. So we were able to break into like groups of 10 and really listen and have some nice facilitated discussion. It was very, very, very powerful and very informative. And then in the evening, we had a full Spanish speaking session, which was amazing. And we had 14 community members there. And again, really received some incredible feedback from that specific population. Some themes on the feedback, as far as I kind of picked 2 things that really rang up as far as some positive feedback and then some additional opportunity, is just the effectiveness and the impact that our behavioral health expansion is having. While it's not perfect, it's definitely the large majority of the feedback was that we're on the right track, and we need to continue that work, obviously. So we will continue to do that, especially with the opening of our pre-court inpatient psych facility, due to open in April, May of 2025. So very exciting there. And then really what we heard, and I heard Heath mention this too, this definitely showed up in the Eagle County's public health survey as well, is just that navigating, right? That navigation piece. And I think we all find that, even me, who's obviously, I'm a nurse, I'm ingrained in our health system, and I still struggle to navigate services and the financial side of it and all of it. So I really feel for our community members in that, and that definitely rang up in those feedback sessions of just more help with that, more assistance with that navigation piece. So that still fits into our plan, but we need to put a little more focus there. And then this will, I'm sure, ring up in our 2025, and we'll probably shift some energy in that space as we put that CHNA and implementation plan forward. So go ahead, next slide. So as far as our 2025 community health needs assessment, we're starting to talk about it and ramp up right now for that. Obviously, we'll leverage data from existing sources including Eagle County's PHIP, and obviously CHNA had some great dashboards. The CDPHE health equity data that's been coming out as of late is really powerful and I think very informative for all of us. And then our own system, electronic medical record data, including our SDOH data. And then obviously anything WMRHA has, we'll use all of it to be able to inform sort of that quantitative side. And then for that qualitative side, as much robust community feedback and listening sessions we can have to be able to make sure we're really capturing that voice. And we'll obviously, as a requirement, we'll do a full evaluation of our 2022 implementation plan and where we sort of landed. And then we'll work to develop our 3-year implementation plan based on the CHNA efforts mentioned above. And we definitely know we'll have an ongoing focus on health equity and definitely know that we will continue to partner with all of you and our community partners moving forward, because again, we can't do it alone. And really, we're looking to really focus on ensuring we're using our CHNA to inform any of our community benefit decisions and activities. So just really connecting the dots between all of that work. And that's all I have. So thank you so much. Let me know if you have any questions.
Thank you, guys. This is a lot of hard work and you guys have come and shared here today. Thank you to you and your team for putting this here today, actually. Before I jump, we have like about 10 minutes left. But before I jump in, question. Actually, does people in the room have a question for our panelist? Or people in the Zoom have a question for our panelists?
See Andy.
I do.
Carolyn.
It's Carolyn. My question is, I was really struck at the last quarterly meeting with the mental health panel, behavioral health panel, how we're really we may be better off for Medicaid clients, but we're really not in great shape since so few commercial insurance clients commercial insurance companies are paying for behavioral health. And, you know, just hearing it again, that mental health is in all of the PHIPs and the hospital transformation assessments. And my own personal experience, I can't get my insurance to pay for a behavioral health provider who is at a Valley View primary care practice, even though Valley View and Roaring Fork Family Physicians contract with United Healthcare. They aren't contracting with behavioral health providers, many. So I'm just curious if there's discussion about how to address that, because now even if you have commercial insurance, it's hard to get coverage. Never mind with private practice, because it's too much of a pain for them to bill. Thoughts?
Yeah, I mean, I can speak for Valley View. Since our last regional health meeting, unfortunately, not much has changed. Barb Cochran, my colleague who was on the panel, spoke to just the fundamental challenges working with payers for reimbursement in the behavioral health care space. And definitely commercial private insurance is a top challenge for us at Valley View. And it's, you know, it's taking intention and work led out by Barb to sit down and look at those contracts and have those conversations to see if we can make some headway to improve access to those services. I wish I had a better response, Carolyn, to your experience. But we're looking into it and are trying to have those conversations and make improvements.
Glad to hear that. Thanks, Faith.
I also think the advocacy work I mentioned, Carolyn, like that's really what we all need to do, is really shift this conversation to the best of our ability at the legislation level. And so continuing those efforts, and then looking at where we can support with funding, you know, through programs like our Olivia's Fund and things like that, to make sure that there's funding available for those who can't afford it and their insurance won't pay for it or whatever that looks like. And then just as Valley View mentioned, you know, continuing to have those conversations with the payers in our contractual agreements.
Great, thank you.
Just to add on to that, it looks like Representative Brown at a state level is going to be working on a bill to ensure mental health insurance coverage aligns with national standards. So I have no idea what that looks like right now. It sounds like it's just being discussed and in the formative stages. So this would be a really good time to actually engage with Representative Brown or others that are in that space, just to provide that rural experience and advocacy. So just doubling down on what Amy provided there.
Thanks, Heath.
Any other question we have in the Zoom or room? Keith, do we have questions? Chris, do you have a question?
Yeah, I guess I really don't have a question. It's more of just a comment. I think in my 9 years, as Christina mentioned in the beginning, that I've been involved with Western Mountain, this is probably the most profound meeting that we've had. I know there's been many within Western Mountain, but to have all the hospitals and the health departments sitting and publicly sharing their strategies, their needs, and looking at where the gaps in care are, that's really what the intention of Western Mountain is. So I just want to major kudos to all of you for your efforts and for sharing it with us all together. This is phenomenal. Hopefully it can come to action, you know, and supporting each of you in your work, because you guys are doing some amazing things.
Thank you, Chris. I have a question. Mason talked about the PHIP advisory board, and if you can talk a little bit more on that, like how can a partner in the community be involved, or explain a little bit more.
Okay, so it is an idea of mine, and it would probably be for Garfield County Public Health. So we had tried to bring it to HSC and it just didn't get on the agenda. But it would be a time where we would come, it would be biannual, so every 6 months, and you wouldn't have to be a part of it. I just don't want to take away from HSC's time to say this is where we are with the PHIP. And so I know adding another meeting onto other people's calendars is not exciting, but that's why we would want to do it every twice a year, and just show all of our partners, this is what we said we would work on, this is where we are, does this still seem to feel right for our county and the people that use the service?
Mason, you know, being co-chair of the Human Service Commission for Garfield County, I think that coming up in this new calendar year, we can definitely work with you to carve out meeting dates and times that will work. Okay, we don't need to go to the next meeting.
Okay. This seems like it's a theme that so many more people are gaining traction and interested in. It's just a matter of trying to figure out logistically how to do that, but that engagement to guide those public health plans and the community benefit plans from the hospitals. I mean, that's where it's at.
Looking at the time, do you guys have anything to further or anything to ask out of the people in Zoom room and the room?
I've got a question for Mason. Yeah. And I can help answer it too, but I'm thinking we've had this wonderful opportunity to kind of talk about our public health improvement plans and the community benefit plans, but there's also another regional entity that we haven't talked about here, and so that's the Region 5 Opioid Abatement Council. Oh yeah. Mason and I both sit on that, and we're representing the needs of Pitkin, Garfield, Eagle, Summit, and Lake counties. So 2 of which are not maybe present in the room, but nevertheless, do you want to talk briefly about the 3 priorities that we currently have in place, and I can talk about strategic planning? Sure.
So our current 3 priority areas were anti-stigma and education. The second one was harm reduction, and the third one was a data dashboard. You should have seen, and if you haven't, look them up. They're called Community Compass. They're on all of the social media sites. They are a regional resource guide and anti-stigma. So there are people that have been who are either doing direct services, people who are talking about their own recovery life, etc. So if on your social media sites, find them and post them to get them a little more traction. And then the harm reduction is High Rockies harm reduction. We are definitely working with her to expand her services, Maggie Saldine, It's actually also a nonprofit, working out of Carbondale, but working in all 5 counties. And then our data dashboard, I just got an email on Friday about the dashboard. So the dashboard was really supposed to be a jumping off point. And that will be run through the Omni Institute, so that it's not one county's responsibility to collect and keep all of this data. We'll keep it, and so I'm very interested to see what they have in terms of their measures and the data points that they've collected. They've said that they have some good ones. And so, yeah, well, we're still working on some of that stuff. All of that.
Awesome, thanks for that. Mason, maybe just one other thing, all 5 counties, I think Pitkin County is out in front in terms of actually getting some press releases relative to community compass. So really appreciated for their leadership there, and then I think you'll start to see some of those press releases coming out for the other 4 counties in the very near future. In terms of strategic planning, those 3 priorities that Mason talked about were the first 2 year priorities, and so we're engaging actually in the next strategic planning process. So if this is a space that you're interested in, I would say reach out to myself or Mason. We can get you involved. There's going to be some small strategic planning work groups that are brought together to start to form what that should look like for the entire region over the next say 3 months.
Yeah, and so the opioid abatement funding is not static in terms of what we were able to do with it. Whereas the tobacco settlement dollars are pretty static. You have to do the same thing. You can tailor it a little bit, but you basically have to do the same thing. We are required as a council to come up with a strategic plan every 2 years on how to spend the dollars that come in. And so it helps us, I think, for more what we were talking about, a more real-time idea of being able to use the funds in ways. So we're not set on the anti-stigma and education campaign. We are not fully in for harm reduction for 18 years, and we're not in the vein for the data dashboard for all 18 years, because it is 18 years of funding. So you know, if we have different priorities, and now that we have done some community work, if you all or your organization was not involved in those first sets of strategic plans, and you feel like it would work for you, make sure that you contact one of us, and we'll be part of that.
Thank you, Lisa. Yeah, thank you. Is there any other comment or request to the audience?
Ariel made hers, but I'll say it again. She would like, if you are PCP.
Get out of this room.
Or a practice manager, and maybe can coerce some PCP in their practice to reaching out to me.
We can. Thank you.
One question. I'm not sure if I misunderstood it or I did understand it correctly, but I'm curious. And this is not just question related on regional level, but county levels. Are there any intentions for in regards to integration of data? Because I feel like all of your organizations are doing so much research. But do you plan on integrating new data?
So I think probably it's a little difficult to do. So I would say probably with the opioid abatement dashboard that will be probably the integration of regional data, but it's difficult. I would find it difficult to do that unless we had a priority. So we as all entities have collected this particular measure for each of us, because we're collecting data in a different, we're not necessarily all collecting the same data. There is some idea working through CALFA, which is the Colorado Association of Local Public Health Organizations, on data modernization. That also includes Civic, and so just for Civic is the data manager for the all payers claim database, allowing people to have access to that. And so it's siloed to the point where something big would have to happen outside of what we can offer. We would gladly give our data to other people, but integrating it into a platform for people to use is something that I don't have the time to take on. I don't think anybody in our organizations do. So, I mean, I love that idea and it's been on all of our minds, but that would be at least a team of people's ideas.
Yeah, and with our new partnership with Civic, some of that may be able to come together.
Yeah, maybe it's just pulling it, because one thing that I would highlight is when you look at the public health improvement plans, most of this data is publicly accessible. It's county and community level data. We're always trying to get better data at smaller levels, like community levels, which in a rural mountain community, it's hard. So I would say, to the degree that, you know, the driving force behind most of our decisions is publicly accessible data to that, and it is sort of integrated, but most of our local public health organizations don't necessarily always provide direct services, and therefore like an electronic medical record looks really different, or just isn't existent at that local level compared to the hospitals or medical sites.
Thank you, we're actually on time. So just for FYI, I'll be sharing slides and the recording of today by the end of this week. And I'm gonna request Sherry to close the meeting.
Yeah, well, thanks, everyone. This was a great discussion. I mean, I think I'll just second what Chris said. It's always nice to get everyone at the table to have these conversations and just moving things forward collectively, even though we're across county lines, and but bringing us all together to work collectively is really what West Mountain is all about. And so we're glad you were here. Thank you to the panel for your wealth of knowledge of everything that's happening within your community and sharing it with us. And thank you all that are in the room today that joined us. We're glad that you came in person. Our next meeting is January 13th, and I think we are still gonna try to do hybrid. We'll see how the weather handles that come January, but more to come then. So yeah, but thanks everyone for coming. We really appreciate it. Thank you.
How are you doing?
I'm good. I am. I think my travels are